Welcome to this video on clinical syndromes in disaster management. This overview explores the identification and management of various chemical exposure syndromes.
Nerve agents enter the body through inhalation or skin absorption. Symptoms range from mild, such as pinpoint pupils and headaches, to serious, including convulsions and respiratory failure. Remember the sludge mnemonic to identify key cholinergic symptoms. Cyanide syndrome is characterized by rapid onset of symptoms. Exposure is often lethal if not addressed immediately. Symptoms include respiratory distress, confusion, and cardiovascular collapse. Survivors of sublethal exposure generally recover quickly. Early management in chemical incidents starts with safety. Ensure proper PPE is worn, or that the patient is fully decontaminated. Stabilize the airway, control hemorrhaging, establish intravenous access, and seek expert toxicological advice as needed. This diagnostic algorithm helps identify potential chemical exposure by matching clinical symptoms to specific syndromes. Follow the pathways to determine if antidotes are required and to initiate the appropriate supportive care. Chlorine and other irritant gases act as powerful irritants and corrosives. Exposure primarily affects the respiratory system, eyes, and skin. High concentrations can be fatal, requiring immediate supportive treatment. Management for gas exposure involves decontaminating the patient and ensuring respiratory support. Monitor for delayed symptoms, such as pulmonary edema, and address local injuries symptomatically. Cyanogen exposure is extremely rapid, often leading to death via respiratory arrest. Speed is critical. Do not perform mouth-to-mouth resuscitation on exposed victims to prevent secondary contamination. If a patient is conscious and breathing normally after removal from the source, they may recover spontaneously. However, for those with severe symptoms, antidotes like dicobalt edetate or sodium nitrite should be administered. Lewisite is a vesicant that causes immediate pain and blistering upon contact. Systemic effects can mimic arsenic poisoning. Rapid decontamination is essential to mitigate tissue damage. Management of Lewisite exposure focuses on decontamination, pain control, and supportive care for skin and eye injuries. Dimercaprol may be used for systemic toxicity. Mustard agents are vesicants with a delayed onset of symptoms. While exposure is rarely immediately fatal, it causes severe skin, eye, and respiratory damage over time. For mustard exposure, treatment is supportive. Early decontamination is vital. Monitor for delayed complications and manage lesions using appropriate wound care and pain management. Nerve agents, such as organophosphates, are highly toxic and lethal. They cause rapid respiratory failure and muscle paralysis. Early recognition and prompt administration of antidotes are life-saving. Management of nerve agent poisoning requires aggressive administration of atropine, pralidoxime, and diazepam. Ensure proper airway maintenance and continuous monitoring of the patient's status. Phosgene is a potent irritant that primarily affects the respiratory system. Its effects can be delayed, making early identification difficult. Exercise must be avoided, as it can worsen outcomes. In the event of phosgene exposure, decontaminate the patient, maintain the airway, and monitor respiratory status closely. Admit for observation even if the patient appears well initially, as deterioration can be sudden. Ricin and abrin are potent toxalbumins that inhibit protein synthesis, potentially leading to multi-organ failure. Symptoms are often delayed, and poisoning is typically the result of deliberate release. Management for ricin or abrin exposure includes decontamination, airway protection, and supportive care. Patients should be monitored, and respiratory or gastrointestinal fluid losses must be corrected. Riot control agents like tear gas or pepper spray are designed as short-acting irritants. While usually not fatal, they cause immediate discomfort in the eyes, skin, and respiratory tract. Decontamination for riot control agents should prioritize washing with water and detergent. Avoid using bleach as it can increase negative effects. Supportive care is generally sufficient for recovery. Recognizing a biological incident requires vigilance for unusual patterns, such as unexplained illnesses, clusters of identical symptoms, or cases occurring out of season. Always consider the potential for deliberate release. This overview highlights the clinical features of various biological agents. Early identification of symptoms like sudden fever, skin lesions, or respiratory distress is key to containment. Anthrax can present through skin, inhalation, or ingestion. Each route requires specific diagnostic and management considerations, with inhalation anthrax being particularly severe. Smallpox presents with characteristic clinical features. Understanding these patterns is essential for health professionals to differentiate it from other vesicular rashes and initiate appropriate isolation protocols. Plague manifests in different forms, including bubonic and pneumonic. Prompt recognition of these distinct clinical syndromes is vital for effective patient treatment and limiting the spread of infection. Viral hemorrhagic fevers represent a group of severe, often fatal, diseases. Monitoring for signs like unexplained bleeding and high fever is crucial for identification in a clinical setting. Tularemia can be acquired through various routes. Clinicians must be aware of the different presentations, as symptoms can be nonspecific, complicating an initial diagnosis. Brucellosis and Q fever are zoonotic diseases with significant public health implications. Recognizing the clinical symptoms and exposure history is essential for timely medical intervention. In any biological crisis, early notification of public health authorities and adherence to biosafety protocols are paramount to protecting both the public and clinical staff. Let's review the general approach to managing potential disaster-related clinical syndromes. Safety and personal protective equipment are always the first priorities when responding to a scene. Triage protocols must be established early to manage patient flow efficiently. In large-scale incidents, standardizing assessment tools helps ensure that those with the most urgent needs receive care first. Decontamination is a critical step in chemical incidents. Effective removal of the agent prevents secondary exposure and protects hospital staff and other patients from harm. Clinicians should remain alert for delayed symptoms. Many chemical and biological exposures do not present immediately, and careful observation is required to detect late-stage health changes. In conclusion, maintaining a high index of suspicion, adhering to established protocols, and coordinating with public health authorities are the cornerstones of effective disaster response and patient recovery.